So yeah, I'm gonna do the reflections of OCD simulations, and I'm gonna answer the question one by one. So first question was like how I felt throughout the simulations, my emotions. Talking about it, like at first I was really shocked, knowing that I'm having such intrusive thoughts that I am wishing my partner to get a cancer, and that is very not like disturbing for me. And I am very frustrated through the system and the process because I have to go to a doctor and I can't express what I'm actually feeling. And she's not giving me the exact diagnosis, and I'm trying to reach to other sources like the health functioner, and they are saying me to get the exact document where it's written my diagnosis OCD, and I have to go again back and forth to doctor to get a written documentations that I am having a OCD, and she's not giving me. So the entire process was really frustrating. I was physically, emotionally, and psychologically tired. I was really anxious. I am worried that I might harm my partner, and the real world is different, but I am having those emotional thoughts, and that is really harmful for my partner and might be harmful for me. So I'm really confused, and I don't know what to do next. So yeah, those were all emotions that I felt throughout the simulations. Talking about the second questions, that's it. Yeah, like I think people will go through the same experience that I went through emotionally, and they will experience those all symptoms like anxious, they will be worried, they will be physically, emotionally tired, and yeah, those emotions, I think the same emotions they will go through as you have to, search in a website that what your symptoms are, and you don't know exactly what is causing it. Trying to reach to local resources which you don't know they will help you or not, and you're worried that some if you tell the truth that your confidentiality might be broken, people in your community, your partner, what they will think. So yeah, all those things will make you more anxious, worried, fearful, um, frustrations, as well as frustrations going on. I think yeah, those symptoms, those emotions, they will have like me, that I felt throughout the simulations. Talking about the third questions was yeah, my view for OCD patient has definitely changed, because before I used to think like OCD is just a disease, where you will just every time wash your hands, you need everything tidy, everything perfect, you are fear to even shake your hand with other people, and you need your clothes to be ironed enough, you don't need any wrinkles in your bed. Yeah, all those things I thought were the symptoms of for OCD patients, but I never thought that such thought will come, like wishing your partner to get cancer is not a normal thought, and OCD patient will go through those thinking, and that's really disturbing. So yeah, my obviously my thinking has been changed for OCD client, and I have like more empathy toward them, because I actually feel how they go through emotionally. So yeah, definitely it has changed. And talking about other question was like, yeah, before the simulation I used to think like navigation like job is just like a normal, you will just help client to reach to your local resources, and help them to like solve their problems. So I used to think it was just a normal job, but after watching the simulation I felt like it's really crucial for the community people, because they don't know about the resources. Actually, they don't know what they are going through and what exact resources will help them. So yes, it has definitely strengthened for me, this job, and I kind of feel like I am really important for community people after my graduation as well. So I think yes, it has definitely changed. Navigation is really important for people to reach to the exact resources what they need, and to help them solve their problems. The last question was like how navigator will help client to deal with it. Suppose if I was a navigator, and if I have to deal with such client, then first thing what I will do is I'll help to build a rapport, gain the trust, uh, know exact information, what her feelings are, what she is going through, like her thoughts. I'll get to know, I'll explore more, and then I will try to connect her to a doctor. That's that, just a doctor, and then I will tell her the exact symptoms on behalf of her, if the client agreed to do. And I can go with her to the clinic. I can, on behalf of her, I can explain the doctor what she's going through, what her symptoms are, and then we can help find her a psychiatric who will deal with the OCD. And talking about the counseling therapist and all, there are different resources that will help her and provide free counseling, like Health and North. They have free counseling therapy, and then they will help you through different cognitive behavior therapy and all that. There's also a different like mood and anxiety disorder services that provides in Cedar Street. They will help the client with the OCD to resolve her anxiety, and they will provide different counseling services as well. So yeah, by connecting her to the local resources, and I will be booking her appointments, and I can walk with her, so that she won't be more fearful while driving alone. I can be with her, so by those things I can support her and help to solve her problem. So yeah, thank you.